All right, guys, welcome back. I'm kind of going to do an update video on my Delta bag because I've had a lot of comments and a lot of questions. And that bag was underpacked. I had somebody ask, it's basically just why such an expensive bag for an IFAC, and I kind of wanted to go more in depth on what this bag's actually for, right? So this bag is to have overflow or excess to deal with a larger amount of casualties than just your IFAC can deal with. Because there's some things that your personal IFAC that you're carrying can't treat. Pelvic injuries, like I was talking about with pelvic binders. Now, I don't have one yet for this kit. They're quite expensive for whatever reason. And then also for doing croics. So I have a croic kit here as well. And then like carrying your blizzard trauma blanket, like those are things, and also SAM splint you're not going to carry in your IFAC. Now, I guess some dudes are, depending on their medics, right, are requiring them to also carry, or they're building a smaller croic kit that's broke down. So I will break this one down in this video and kind of show you what you need. I am trained on that, so I will carry it. I don't have IV supplies, but that should be coming in at a later date. But this is going to be the last time I'm going to really cover this in depth. So we'll go through all of what I have here, this new contents, and it'll make a lot more sense now that I have this completed, right, if you will, because I don't really know if there's going to be room for fluids after I get all this in here. So we'll see what happens with that, and then we'll go from there, right? So we're going to start with our massive bleeding, right? So we're going to start, still got our 2 tourniquets, right? I can always carry more, but all the guys in my team are going to carry 2 tourniquets minimum. And a lot of the guys, they just carry 1 for each limb. Not that that's ever going to happen, but it could. So they carry those. So we got our 2 tourniquets, right? I'm going to leave those off to the side for now. And then we have our gauze. We have S-rolled. I got 4 S-rolled, brand new S-rolled gauze, and then I have my 3 packs of combat gauze. So these I'm gonna put up in the front here, right? Again, kind of at that top. This is where I want all my massive bleeding. It's like accessible right away. Now I know it's in the top of the bag, right? So let's do this. We'll pack 2 and 2. So we'll put 2 in the front, combat gauze, 2 your regular S-rolled, and then we're gonna just a smaller 6-inch emergency trauma dressing. We'll see if we can get 2 up in here. Okay, so we got that pouch packed well, right? So we can close that up. The rest of that contents can go in the back, but we'll get to that later. I keep all my zippers in the middle so I can pull them either way. Okay, so we get through the massive bleeding portion, right, with our tourniquets and our gauze to pack junctional wounds, right? Because obviously you can't tourniquet an armpit. You're gonna have to pack that. There's nothing else you can do, or a groin injury also. So we got our materials to pack. We got our materials to stop extremities from bleeding, and then so now we get through the massive bleeding portion, and then we'll go into airway, right? So I got 2 new NPAs with the lubricant for the airway portion here, and then so I'm gonna rubber band those up so that they're obviously not flying around in there. But that's our airway, right? Well, we also have a croic kit. Now this is going to be like something you're going to use if they have severe trauma to the face, right? Something you can't put an NPA in, or you can't access their throat through their mouth to get them to breathe, right? So now this thing, I'm pretty sure it's expired, which is cool. It doesn't matter because it is a sterile item. Let's see, is it all separated in here? Yeah, okay. So you're gonna need these, your forceps, or is that what they, yeah, forceps. So you're gonna need your forceps, and then let's see what else. Where's the scalpel? Now, you're gonna need your scalpel. And I'm hoping this is not, make sure this, I just don't want to spill this all out on the floor so that it is still clean, so you can perform this, right? Because this is an advanced thing to train on. Now this one's quite old, so I'm actually probably gonna end up having to get a new one, but regardless, so we'll kind of go over this, right? For a Croy kit, what you're actually gonna need. You're gonna need forceps and you're gonna need a scalpel. You gotta need the scalpel to make the cuts, and you're going to need your forceps to get in there, right? Because you have to open it up once you cut it with the forceps. You're gonna need this to inflate the bulb on the, I don't even remember what it's called. Wow, this one's very, very old. Same system, but anyway. So I'll kind of do a little show, right? Need to inflate the bulb to hold it in the patient's throat, right? Or where you perform the Croy, which this here is the bulb, right? That gets inserted after you make the cut, and then you inflate it so it can't pull out. So this is what I'd keep in there. Now, you don't really need this shit here. You can just tape it to them. Get rid of all this, just any excess junk, right, that you don't need. But I'm gonna keep it there just for this. It's not sterile anymore. Like, it's old, but anyway. So you're gonna need, this is all you need for a Croy kit. This is super, super simple, right? So this can break down and be, now it's a lot smaller than all this shit that you don't need that. You don't need this bag, you don't need this shit. This is in the field. Like, you're doing this as hastily as possible, right? So you're not gonna need any of that. So we'll get rid of that. I'm gonna put this back in this bag. And then just roll this up. And this is your Croy kit, right? This is another thing you can perform for your Airway. And I'll be honest, I'm gonna just put this in the back due to its size for now. The newer Croy kits are not that large. I don't know why that one is, but that's just the way it is. All right, so now we'll get into the respiration portion, right? So for that even rise and fall in the chest, right, is gonna, whatever's going on, whatever their symptoms are showing is gonna dictate what you're gonna do. Obviously, if they get a gunshot wound to the chest, you're gonna hit it with the chest seal. The chest seal doesn't do the job for whatever reason, then the next thing you're gonna go to is gonna end up being a needle D, right? You got to release the pressure from the chest because you need the lungs, or the pressure in that cavity to return back to as normal as you can get it. And the chest seal should do that. But if it doesn't, the needle D should get you there if you place it in the right location to the affected side, right? The affected side, the lung that is collapsed and not filling back with air. So I'm gonna put these needle Ds back on the sides, and I'm gonna put these chest seals in here, and then I'm gonna talk a little bit about another thing you can do to help your patient regain control over their breathing. Now sometimes it's not that the chest cavity is filling up with air, sometimes it's filling up with fluid. So there's a thing that you can do that's called a finger thorpe, right? I am not trained on the finger thorpe, but I know of it and how to do it, but I'm not trained on it, so it's nothing I would ever perform. But it is what it is you make an incision in the same location that you would with the needle D, and you will basically make a hole and put your thumb in it and allow the fluids to exit that cavity or the cavity of their body so that their lung is not impeded by fluids, because they're basically drowning, right? So we got to get the blood out of there. So anyway, that's another option, but I got a scalpel and forceps, so I could still perform it if I had to, with the Croy kit, minus the basically the catheter with the bulb on it. You wouldn't need to use that in that scenario. Okay, so I'm also going to throw in in this Airway pouch, I'm going to throw in my tape here. So I have access to it at the front to secure whatever I have to secure, whether it's bandages or eye shields, right? So that pouch has got some contents in it, right? So we've hit massive bleeding, airway, we've hit respiration. Now, I don't have circulation, right? But we have some other things that we need to put in here still, right? So you could also use this bag itself as a chest seal if there was enough casualties where I have run out of chest seals to perform that. And then this also for petroleum gauze for burns as well, because you don't want dry gauze sticking to wounds like that. So I'm going to put that in there along with this one ace wrap that I have here, because now that I have more emergency trauma dressings, I don't need as many ace wraps, because I have those, and those do the same thing, and they also have a big gauze pad on it to soak up any excess blood. So this ace wrap is primarily for the SAM splint, and then also for another splinting thing, right? I have 3 triangular bandages for splinting as well. So I'm kind of going to start putting this equipment in here. Okay, anyway, sorry about that, guys. So I'm also going to put these up in here along with, because the rest of my splinting stuff is going to go in here. Then the ace wrap will go in the back. And then I'm also going to place my tourniquets in here so they're a little more readily accessible. But it doesn't really matter how you organize your bag, just set it up so you know where the equipment is. And also your team knows where the equipment is in the bag if you go down and you can't treat your people. So, okay, so we're gonna open this thing up. So I got my Croy kit in there. I'm also gonna throw this SAM splint in there. It'd be super awesome if I had some like pouches to organize stuff in here. I think they do have some Velcro back stuff with elastic bands on it, so you can loop stuff in there. But if I'm opening this portion of the bag, I'm probably okay to just open it up. It's gonna be a more relaxed environment, right? So I'm gonna put my extra gauze in here, my S-rolled and my combat gauze. And then I'm also going to put my emergency trauma dressings in here as well. So we get all this packed in here, right? And then we still have for the hypothermia, right? So this is the last one we need to hit, is the hypothermia, so the blizzard trauma blanket. Perfect, still got that. So now I can close this up, right? This bag, like, it holds a reasonable amount of equipment, but it's not crazy. So it's kind of you gotta pack what you need and not a whole lot extra, because you can only put so much in here. And this bag is set up to treat a squad, right? Which seems kind of crazy that this is an entire squad is supposed to be able to be treated based off of this bag, or the amount of casualties a squad could take. Sorry, you guys, about the phone going off. It's just work. So we're gonna set this bag up correctly so it's ready to go. Next time I have to use it, give me 1 second so I can deal with this phone. Bag is packed there, right? Okay, and you see we still have some remaining items that need to go into this bag still. So let's put these, wrap this stuff back up here. Don't like having shit dangling everywhere. This goes for your rucks too. Same thing. Keep it kind of organized, right? Okay, so we still got these 2 more pockets in the back of the bags. So we have casualty cards, right? So this is going to be something that you're going to fill out and keep tied to your casualty so that when you do transport him or hand him over to somebody to go get him more help, right, than you can offer, whether that is the hospital, an ambulance, or just first responders in general, if that is an option. You're going to have this filled out, right, so that they can look at this and they can see what drugs you've administered and any treatments that have been done. So obviously, as you can see, you can fill in the bubble, right? GSWs, blast, thermal, or blunt trauma, and then you can also just fill out other. And then the identification number, right? That could be social security number, DOD ID number, depending on what scenario this is taking place in, right? Or their last name. And then in here, you also have inside these bags, which these are kind of sweet. You have this little pre-packed thing here, right? So you can leave these tethered to them, and then you can, depending on what treatment or level of treatment your casualty needs, so you can triage, right? So minimal, dead, and then you have immediate, right? And then you have, or delayed and immediate, right? So you got to triage your patients if you have a mass cap. So, and then you also have, what is this here? Oh, times that you applied tourniquets also. So these are kind of convenient if you have the option to be able to have time to write this shit down, obviously. Sometimes you're not going to. The casualty card does need to be filled out. And it also has a mini chem in it for immediate or priority, right? So you can mark where your casualty is if it's dark out. So that's what these are, which I had some of those in the other bag, or had some in this bag, but I didn't go over them. So we're gonna put those in the bottom, right? Put these in the bottom of the bag. One of the things that I will need to get to, but not super quickly. So in here, we have this casualty reference card. So this is kind of sweet. It kind of just gives you the symptoms and how to treat them, right? Tactical field care. Yeah, like there's an extreme amount of information in here. If you needed to quickly reference something, you can, right? And then, oh, look at that. Then the packing list also. So you can fill out what's supposed to be in here. Make your life a little easier when you're replenishing. Throw that in there just because, who knows, you might need it. And it never hurts to have that to be able to just brush up on if you're feeling like it. Okay, so we're gonna put these eye shields in here, right, for any injuries of that sort that need that. And that's also what the tape's for inside, for securing that. Oh, and I have some old ones in here too. So we're gonna use these new ones, right? I got 3 of those, I believe. 4, sorry. 4 of those. And then alcohol prep pads again. Just sterilizing, if at all possible, when you can. And then I have these 5 pairs of nitrile gloves. We'll also put those in the back. Use them if you can. Obviously, in a civilian setting, please put gloves on if you have time. You're not getting shot at, right? You're gonna have a lot more time to be able to do that. So now that is what this bag should really look like. Before I did that video, I should have done this. So this is just gonna be a good update. I really kind of covered the bases really well in this video, a lot better than the other one. So let's just see how this video goes. If you guys have any questions, put them down in the comments. I've been responding to everybody that's been shooting up comments on those videos. I'm gonna get this video up today so that you guys can kind of hit me back on your thoughts about that, because this is what this bag really should look like. I wish I could carry a IV fluids in here, but then again, this bag is not made to do that. That's what an aid bag is. An aid bag is larger, right, with more extended field care. This is like to treat. This is to hit all your bases as small as possible, as light as possible, so that, you know, someone in a team can carry this for their entire squad. And then obviously your medic is going to carry his aid bag, so he's going to have everything, all of this and some. So just remember that, like, this is going to be a lot smaller, just to treat a smaller amount of people and not a mass casualty kind of thing. That's why there's only 2 casualty care cards in there. Because if you have taken more than 2 casualties in a squad of dudes, it's a serious problem if you don't have a medic, right? Like, this bag can only treat so much. So, all right, guys. Yeah, please like, comment, subscribe. I'll see you in the next video. And